everyone to our webinar on digital health service delivery in Europe and what we can learn from the pandemic. It's a pleasure to be organizing this webinar shortly before the winter break, so the holidays, to reflect on what we can glean from our experience of the last 2 years about where we might want to concentrate on going with digital health solutions in the next few years. So as we are all aware, digital health solutions that had difficulties being implemented before the pandemic hit very quickly became indispensable during COVID-19, and a lot of emergency measures were put in place, both regulatory and financial, to ensure that health service delivery could continue by digital means. But now we've had a while to reflect on how this has evolved and how effective and how patient-centered it has been. So we thought that this is the perfect opportunity to look back and think about how we can make sure that valuable digital health solutions continue to be implemented for the best benefit of citizens and patients, and how we can make sure that we don't necessarily invest in those technologies that maybe are not the best options for our patients. It is a pleasure to be organizing this webinar as part of the Observatory webinars, but as a special collaboration with the European Public Health Alliance. And I go to our colleague, Philip Karen, who will tell us a little bit about why this topic is important for EPHA. Philip, over to you.
Thank you so much, Dimitra. And hi, everyone. My name is Philip from EPHA. Digital health in general is one of our key 7 policy areas that we work on at EPHA, that we look at. And this webinar is particularly important to us, as we have done in 2021 and previously. Some case studies, written some case studies, and done some research on how particularly digitalization of healthcare services has been propelled during COVID. And we looked at how this transformation was done during the pandemic. However, we haven't really been looking into what has been going on since, let's say, the pandemic has kind of relaxed and now we're in a much more comfortable position with our healthcare systems. We also want to make sure that these digital transformations of health and care are inclusive, that they're complementing services where services might be lacking, but that they're not replacing existing services which might be functioning well already. So that we want to make sure that digital solutions work in service of people and to reduce health inequalities rather than exacerbate them. Yeah, and I'm really excited for this webinar today, and I think I'm going to hand over now to Nicole, who's going to have an interesting poll for all of you participants to answer.
Yes, Lucy, could you please provide the poll question? Thank you very much. So as Dimi and Philip have anticipated, we have prepared some questions to get you started. The first one is about whether your countries have implemented digital health service delivery solutions in response to the COVID-19 pandemic. So very simple yes or no question. And what have been the implications of this for regulatory, financial, and legal frameworks? So the second question addresses exactly this point. So for the adoption of digital health solutions, have these framework conditions evolved in your country during the pandemic? And here you can choose more than one, especially because maybe these conditions have been different for the regulatory side or for the financial side, and they may have evolved in different ways. The answer options are: emergency mechanisms have been introduced during the pandemic and they are still currently in place. But it might also be that some of these emergency mechanisms have been already transformed into long-term solutions. They may already also have been removed. So that's the question answer 3. And finally, existing mechanisms were not adapted as part of the COVID-19 response. We have also included 2 options in case that is not the case in your country. So you may also select other or none of the above. And we'll give you some time to reflect on these questions, and we will present the results after our first speaker, after our first keynote presentation. Thank you.
Thank you very much, Nicole. You might need to scroll down in the pop-up poll window to see all the options. And in order to give you time to think about this, is also not a very straightforward answer necessarily, or easy to know which applies. But it will be really interesting to see what your experiences are. I will briefly introduce our stellar panel for today. So we're very, very lucky that we have been able to engage a really amazing lineup with very varied experiences and backgrounds when it comes to digital health. So we will hear first from David Novillo-Ortiz, who is a unit head and regional advisor on data and digital health at the World Health Organization's Regional Office for Europe. He will give us an overview of recent activities that are really useful for all countries and settings. We will then go to 3 spotlight speakers from different settings and from different countries. We'll start with Stefan Putigig, who's coming from Malta, and he is a specialist public health resident at the Ministry of Health in Malta, focusing on data and digital health, Stefan, but is also the VP of the section on digital health at the European Public Health Association, and so he has also from the collective experience of EPHA a lot of knowledge to bring us. We also have Mirko Klaus from the Veneto region in Italy. He's a medical doctor who works at the Directorate for Healthcare Planning and with a focus on telemedicine and digital solutions. And finally, we have Aiden Tamahari from the umbrella organizations of the French health insurers. He is the deputy director of the Directorate on Service and Statistics Strategy, I think is the closest translation, Aiden, from the French. So we will hear also from you, from the payer side, what's been going on in France and what we can learn. So without further ado, I would pass to David to give us his reflections and introduce us to the topic. Thank you, David.
Thank you so much, Dimitra and Nicole, and thank you so much for inviting us today. And also, it's a pleasure to share this panel with Philippe, Stefan, Aiden, and Mirko. It's really much appreciated. So what I'm going to present briefly during these 9 to 10 minutes is just an overview of the Regional Digital Health Action Plan for the European region that was adopted in September this year in Israel during our regional committee. Our regional committee, just for you to know, is our high-level meeting with the ministers of health across the 53 countries that are part of WHO Europe. And during this meeting, this action plan that I'm going to briefly present today was adopted by all the member states. Next slide, please. So first of all, a bit of a background of why WHO Europe stepped forward with this plan. So first of all, this is a diverse region. As you can imagine, we cover 53 countries. We have countries with a population of 34,000 people, but also we are covering countries with 146 million population. So this is a very diverse region, and as you can imagine, and one approach fits all can be used in this case. Also, when looking at the different health and situation and trends, as you can imagine, this region is facing several challenges, as at the global level, related to NCDs, alcohol consumption, maternal mortality, etc. No, not to mention mental health. Of course, I mean, I will speak for an hour, and I would like to mention all the health challenges that we have in our region. But also interesting to know our differences across digital environments. So, for example, our region, 85% of the population in our region is connected to internet, and actually, as you may imagine, we have more mobiles than people. So, approximately, we have 120 mobiles per 100 people. So that is just an overview of how we are doing in terms of digital and then health situation and trends. Also looking at the COVID-19 pandemic, that is the most recent event that we have had from a public health emergency, we have learned a lot during this pandemic. And that is also something that we have considered when developing this action plan. So we have found several challenges when looking for the definition, the calculation, and the format of the data during the COVID-19 pandemic. I think that almost all countries has struggled finding this solution to have heterogeneous data. But also, we have seen how we have lacked people that is trained to really operate with data and digital solutions during this pandemic. So that also was a red flag to us to really act as quickly as possible to propose solutions in this area. And finally, I would like to refer as part of the background of this document about this digital health fever, right? So there is no country at the global level that is desperate to implement digital solutions. But usually we are quite conservative in this regard, because we have always said, and I am regularly repeating this all the time, that when digitalizing data and health information systems, when you digitize a broken data process, in return, you will have a digitized broken data process. And that is the reason we try to all the time to high-level policy decision makers to make them understand the importance of investing on data and quality of data. Next slide, please. Moving to the action plan itself. So basically what we propose is 4 strategic objectives, 18 key regional area, focus areas, and 21 illustrative actions. Just for you to know, and I don't have much time to elaborate on this, this was a consultative process. We invited all the member states through our governance processes and mechanisms to be part of this action plan, and we're so thankful that all the member states contributed to this effort. But also we invited all the international organizations, including European Commission, OECD, World Bank, and several partners. I think it was around 15 international partners were also part of this development process. So I think that this helped us a lot to also have an overview about what is needed for the European region, and particularly for the period 2023-2030. Next slide, please. So just going to explain briefly the 4 strategic objectives. So the first is related to promote awareness and fill evidence and gaps. So if you're looking at other health areas or public health areas, you can already see a lot of evidence developed and agreed around different topics, right? Communicable diseases, non-communicable diseases. There is very well-known evidence about this. When you're looking at digital health, we have important gaps about what is really working. So that is the reason we are really committed to develop norms and technical guidance to support member states, but also develop this awareness about the importance of investing on digital health. Also, the second strategic objective is about enhanced country support. This includes assess country capacities and helping to implement this technical guidance. So we have noticed that this is not only about developing digital solutions, but to help them to implement these solutions in a proper and successful way. The third strategic objective is more related about networking and knowledge and change. And we emphasize a lot about this because particularly in this area of work, as you can imagine, there is a lot of lessons learned that we should be sharing and we are not sharing, and particularly about failures, right? So when you are looking at this area of work, this is an area of work in which you need to invest a lot. So it would be good that all countries are open when sharing failures, particularly failures when working on this area of work. So we are looking forward, of course, not to just talk about the failures, also about the successes, but particularly to help those countries that are investing now in how they can move forward in an appropriate way. And finally, the last strategic objective is about monitoring digital health. That is a gap that we currently have at the global level and not at the European level. So we are really committed and we have started some efforts in how to monitor digital health at the country level, and we will continue doing that. This will help us also to identify digital solutions that are currently working well, so we can really scale that up at the regional and at the global level. So this is overall the 4 strategic objectives, basically develop knowledge and technical guidance, enhance country capacity, strengthen networking and knowledge exchange, and also horizon and scanning and scale up. Next slide, please. So something that I would like, and I am almost finishing, as part of this process, we also conducted a survey to the member states to know also what are their priorities and needs related to digital health. So just we have more information and just sharing this slide. We're also we are actually publishing a report about the status of digital health in the European region in the first quarter, early next year, and we will have a full report about the overview of digital health in the European region. But just to mention to you that when asking member states about their priorities, about key regional focus areas, the member states, the countries, told us that the first 5 priorities for them are strengthening digital health literacy skills. That is an area where that we should continue strengthening. Also strengthening health information systems and health data governance. Also predictive analytics, particularly related to big data and artificial intelligence. The 4th priority area that we were told that is a priority is dissemination of this exchange of good practices that I just mentioned. And finally, to focus on the patient and the people, right? And also actually during the pandemic, we have seen this situation in which, for example, developing the contact tracing apps, not everyone has been be part of this process, and we have seen how some of these solutions has not been successfully deployed for the lack of engagement of the health workers and also the population. So there is a lot of lesson learned that we can take from this. And just the next slide, please. To invite all of you, so what I have presented briefly today, we have just published an editorial in the bulletin of the World Health Organization that is signed by our regional director, Dr. Hans Kluge, but also our divisional director, Dr. Natasha Sopardi-Muscat. The link is there. It's a 5-minute read. So we would like to really encourage you, if you have these 5 minutes, to look at this editorial and to learn more about our views and plans on digital health for the WHO European region. Thank you so much again.
Thank you so much. That was a very insightful presentation. I hope I will definitely be keeping an eye on the report next year. And I think now we are ready to go to Nicole for the results of the poll, if I'm not mistaken.
Yes. So if we can see the results on the screen. Okay. Well, the first one is certainly no surprise. It seems that all of your countries have actually chosen to implement digital health service delivery solutions during the COVID-19 response. The responses are more mixed when we look at the second question. So it seems that the ones that have been introduced as part of the COVID-19 pandemic in most countries have actually been transformed already into long-term solutions. The second most common answer, which is also, let's say, at the same level as the third option, is that the emergency solutions are still in place, but it seems that in the same amount of countries, they have actually been removed. So this is very interesting, and I think we will hear now from our subsequent speakers how the situation has evolved in their countries. Thank you, Philip.
Hi, thanks everyone. So I'm Dr. Stefan Budric. I'm a resident specialist in public health medicine working in the Ministry for Health. We've been through a lot. And when we are in these tough times, we had to move quickly and we had to evolve quickly. And in Malta, we've done a couple of things. And just having a look at this slide basically gives you a screenshot of different digital health solutions and digital public health solutions that we've implemented throughout the pandemic, starting from the COVID alert, contact tracing app, linking to the digital passenger locator form, a COVID-19 travel authorization system. We've even been able, over the evolution of the pandemic, so it didn't happen on day one, but we were able to set up a fully streamlined test, track and trace system based in one system, but getting data from other systems, including the COVID results submission portal, which you can see over there as well. And as we evolve, this is only some of the parts, that this is the focus on the public health part. Whereas in primary healthcare, for example, we had the setup of a telemedicine center that we really didn't have before. And this now is going to evolve into another center, which is going to be complementary. And we recorded more than 200,000 episodes at the telemedicine center. So that is something which is truly impressive. And I really want to applaud my primary healthcare colleagues there in that regard. But we also went on data. We were developing internal dashboards. We were also sharing open data out there. So as we evolved and as we went through the pandemic, we continuously grew. Now, if I want to kind of summarize all these different learning lessons in one point, let's say in a couple of points, I would go to my next slide, where I would show you what have been the biggest learning points during the pandemic. One point, which I'm going to start off with, and isn't in the slide, is that legislation is key. So without legislation, you will have less power and less ability to implement even basic data flows. So ensuring the validity of specific data flows, you need legislation on your side. And when we implemented the legislation in Malta to actually ensure that all COVID tests that are done within private and public sectors are reported through a specific portal, it was only then that we were able to ensure that the largest majority of COVID results, especially the positive ones, would come towards the public health workflow. It was only then that we were able to do that. But I also have these 6 points that I want to kind of bring together, and at the same time, also kind of, now that we are moving towards the tail end of the pandemic, also allows me as well to kind of summarize a bit what has been happening as well. So first of all, scaling up of human resources and behavior change. We had to move quickly. We had to scale up human resources at first. But then that was supplemented with a data management and governance process. So there was a team of people fully dedicated that was needed and will continue to be needed as we move on into the next decade, or the famous digital decade. What's also very important is that all these digital health delivery solutions are integrated within the operational workflow, and business continuity needs to be ensured across all different processes. And the mentality needs to be, at the end of the day, is that we need to look towards sustainability. We need to look towards the future. And it's only through sustainability that we can achieve that. And how do you achieve that sustainability? You ensure, as mentioned before, dedicated personnel. You ensure that you have reliable relationships with third-party suppliers if necessary, or with an in-house development team, and ensuring that project management practices are there in place. And when mentioning project management, you can't forget to mention multidisciplinary collaboration. We are not meant to work on our own, and we're meant to work with multiple individuals with multiple technical capabilities to help us even understand the different challenges that might happen with scaling of infrastructure, with scaling up of data. All of these are necessary to help us move forward. And last but not least, now that we're also evolving further, we need to also understand that sometimes we might need to decommission or downscale. As we needed to upscale before, as we were going through the pandemic, we might also need to be aware of decommissioning or downscaling. And even better, knowledge transfer, where features that were possibly even more present in other COVID-19 focused digital health delivery solutions are now transferred to national digital health delivery solutions, where they can benefit the lessons learned from those COVID-19 moments can now be transferred towards national solutions. And with that in mind, I'd like to close off my contribution. Thank you so much.
Thank you so much. One thing that really stood out to me was you mentioning that you recorded 200,000 kind of episodes in the telemedicine center, and considering the small size of Malta's population, that just shows like how widely used that was. That's amazing. All right. Now I would like to hand over to our specialist from the Veneto region, Mirko.
Thank you, Philip. Thank you to the Observatory and the EPHA for the kind invitation. It's a great opportunity for me as a medical doctor working in the primary care unit at the Directorate for Healthcare Planning, the Veneto region in Italy, to present our experience. Next slide, please. In Veneto region, we are in northeast of Italy with nearly 5 million inhabitants, 68 hospitals, nearly 3,000 GPs, so a lot of complexities, but we are part of a national system. As a region, we have been front runners in the development of digital health solution, because since 2005, we have a public consortium, Arsenal, that is in charge for developing IT apps and systems for our hospitals and our healthcare professionals. So we faced the COVID-19 pandemic with 15 years of experience that was running from the e-prescription through the electronic health record, but these were mostly fragmented experiences that needed the momentum of the COVID-19 to make a coherent ecosystem that I will show later. I would like to thank Stefan, because in the first presentation, he underlined the role of the regulatory and the legal framework that were the most important for us changing points during the COVID-19 pandemic. And in specific, at the regional level, we acknowledge the same amount, the tariff for in-person visit as the same amount for the telemedicine during the first wave. this was the first enabling mechanism to deploy the full potential of telemedicine and digital health to all the citizens, also not only through the public hospitals, but also with our private accredited hospital partners. The other one was the major update of the national guidelines in December 2020 that provided us a national, coherent, regulatory and legal framework for the provision of telemedicine services and provided us a coherent remuneration and pricing system. These were the two major acts during the first and second waves of the COVID-19 pandemic that allowed us to deploy to our citizens and to all the patients, as most of the region in Europe and the other countries, the full potential. We didn't stop but there, and we started to develop specific experiences to put in a coherent national framework. In particular, as mentioned before, COVID-19 through the biosurveillance system 1 was the capstone project that we developed during the COVID-19 pandemic. But then we focus more on the shift to the provision of the healthcare services through digital solutions. So we developed telerehabilitation to a specific platform with our Center of Excellence in the region, the Padova Hospital Trust, specific care pathways for multiple sclerosis patients. And also we use the opportunity of the COVID-19 to experiment further the primary health care services through televisits and telemedicine services as a whole. The last one project that was part of this constellation of experiences was the one regarding the health literacy specific for healthcare professionals and health patients. Next slide, please. But all these experiences were ones that should now be parts of a national development, because through the important investment of the National Resilience and Recovery Plan that we see here in the slide, we are now able to put all these local, at the hospital level, at the primary care level, experience at the more regional and national framework, putting all together in the ecosystem to allow our citizens through apps and a unique platform to allow their data and to allow them to access the quality, the better quality of care we can provide. In which way we are doing this? So we are moving through, thanks to this investment, towards a digital infrastructure with a unique sole hospital information system for all our 68 hospitals. We are going to provide a unique home care digital model with a unique home care platform for our 1,000 nurses and for our 3,000 GPs and 500 pediatricians. So digital health is no more for us part of a constellation of single experiences, but we are now moving towards a national and a regional coherent framework to support a big redesign, not only of the hospital services, but most important, the territorial and the primary care services. These are the main focuses of the reform that we are now putting in place and is supporting us through the next years to the 2026. And in particular, we are going to support the redesign of the territorial care services thanks to the digital infrastructure that will provide the technical support for the community centers, the community hospitals, and our territorial operating centrals. These are the physical infrastructures that should be filled by the healthcare professionals that, thanks to this unique gateway, will have the regulatory, the legal basis, but also the clinical data to exploit the full potential we can bring to them. An important, next slide, please. An important element of this digital ecosystem is the national platform for telemedicine that is not only composed by an enabling national telemedicine platform. But most important, we are going to provide through unique vertical solution, the televisit, teleassistancy, the teleconsult, and the telemonitoring vertical solution to our citizens that could access at the regional level through a unique gateway, the all care services. So we capitalized the COVID-19 momentum to shift from a short-term solution to a more medium and long-term solution. And we are going to support them. The whole is the shift through not only the physical infrastructure, the digital one, but also through the support of the change management strategies to support our healthcare professional in using and this kind of solution, and putting the right basis for improved health literacy and digital health literacy for our patients, and the one that can or should be benefit most from this new process. I will give the floor back to Philip, and I will thank you.
Thank you so much for this overview of the telemedicine landscape in Italy, and especially for mentioning the importance of digital and digital health literacy. That's something that we often see forgotten when it comes to these kind of discussions. And last but certainly not least, we're going to Aiden Taj Ahmadi, from our expert from France.
Thank you very much. Interestingly enough, for a presentation on digital health, I have no slides, so I can concentrate on just giving you a couple of insights from the both French perspective and also French payer perspective, because the institution I work for covers approximately 95% of the French population for their healthcare. So we have a global national vision, and as a payer, we also have an interesting, I think, a complementary insight on those challenges regarding health and digital health. But the first thing I'd like to say is probably it's virtually every part of the healthcare system can be touched by the digital aspects, because actually digital is like electricity, so it's a general purpose innovation. So you could take any dimension of the healthcare and find a way it has been affected by IT and digital evolution. So I focus on four parts of the system that were particularly affected and changed by COVID and afterwards. The first one is obviously telemedicine, and specifically teleconsultation and telemonitoring, which were pre-existing in France, but they were at very low levels. Teleconsultation is reimbursed for healthcare professionals since the early 2019, but we were at very, very low levels. So we had like 30,000 consultations per month overall France, which was very low, and COVID completely changed that. So now we have for 2022 approximately 10 million teleconsultations reimbursed. We have more than 50% of GPs who have at least one teleconsultation reimbursed. So this is something that really became an item in the toolbox of doctors. However, it remains quite limited, because if you take the global activity of GPs, for instance, you have only 3%, 3.2% of this activity, which is now teleconsultation. This is quite small regarding the potential impact. So probably this has been something that has been growing. It's now in common practice, in common law, but it's not as impactful as you could have considered it should be. The second dimension is about telesurveillance and telemonitoring. Now we've had experiments about reimbursing telemonitoring for certain conditions and certain populations, and now it's been implemented in the law this year, and this is going to be also becoming common practice. That's a very important transformation, but we are at the frontier for telemonitoring with all the challenges we have to meet regarding the digital technologies and what we are now calling digital therapy, because obviously we have a problem of defining appropriate business models to reimburse correctly for these technologies. And it is a challenge we are now facing, because the question is, should we reimburse and pay for the technology, or should we pay for the investments for the technology, or simply should we consider technology as a part of the care that we pay for, and therefore we should not specifically pay for technology? This is a very interesting question, very tough challenge, because if you want to increase the usage and the impact of this technology, then you should have an answer to this question. I have two other aspects of the impacts that I should like to underscore here. The first one is that basically the number of tools which were used by patients that have no common practice. I'd say, for instance, we have developed a national patient record, which called Mon Espace Santé, my health space. So every patient now, every citizen has a national patient record, and this is something that has been really implemented and pushed by the COVID-19, which we saw the importance of these tools, and the vision of the population regarding this tools have really shifted during the pandemic and afterwards. And this is very interesting to see that, for instance, now we are people using very commonly digital applications to make appointments with doctor, which was something that was not being seen before the pandemics. The fourth area, I think it's very important, is the use of data, and this is regarding the health inequalities, because we've used health data, health indicators to outreach for populations that are far from the care system, which we developed this for vaccination, and that we use this to attract populations and go towards the populations that were far from vaccination. And now we are really considering developing the type of approaches. So using health data, analyzing data to realize who are the people who most need to be cared of. And this raises a number of questions, most notably regulatory questions, legislative questions, but also data privacy questions. And now we are using more and more data in the system. This is something that really has shifted during and after the pandemic. And there is an important question that these data are very impactful to help care for the populations, but also the data privacy question is a very important issue, and the balance between both is probably one of the challenges we have to meet in the years to come. I'll end up my conversation saying that also one of the most important legacy of COVID-19 is that we now have a national strategy for digital health, which was in development before, but now we see that it's very important and all actors are aligned for this development. This is, I think, very important in order to foster new developments and new realizations in digital health for the years to come. Thank you for your attention, and I think I'll leave the floor to Dimitra.
Thank you very much, Aidan, and apologies for improvising on how to pronounce your last name. It's not always the easiest if you're not a French speaker. I pick on the last point you made regarding and I'd like to ask all our panelists to switch on their cameras now and come with us. I'd like to capitalize a pick on the last point that you made about stakeholder alignment, bringing everyone together. I think it was really interesting to see the common threads through your presentations about trying to go from this, let's say, emergency experience in the COVID-19 pandemic to actually more long-term solutions. I'm starting with David, and David, I'll come to you first in a second, reflecting from member states how they need to actually really look in a global way to make sure that they can advance in the digitalization of healthcare. Over to Stefan, who told us about the primary health center that is now the evolution of the telemedicine solution that you had in Malta. And I could really ask you to talk to us more about this. To Mirko with the telemedicine platform, and now all the way to Aidan with the new telemonitoring options and the payment options. So what I would like to ask you all is, because just to draw briefly on what are the, let's say, the secret ingredients or the success factors for actually moving from a solution that you have to implement quickly or you have to build on quickly if you had it before, like Aidan was saying about having telemonitoring before, but quickly having to scale it up, to actually thinking about the long-term or more long-term there were more long-term implications. And you told us more, all of you, a little bit more on the normative side, but if you can reflect on your practical experience on what have been, let's say, the takeaway messages of what to do to actually know how to deal with perpetuating a good practice, that would be great. David, I come to you first, and then perhaps we take the sequence that we had, I think would work really well. So we go to Stefan, then Mirko, then Aidan at the end. David, over to you.
Thank you so much, Dimitra. So it's not an easy question because how to scale up and how to maintain the sustainability. from my point of view, and of course, all the colleagues from a country perspective have more experience than me, but looking from a regional perspective, we can see that the lack of vision, the lack of governance, it will have a long-term impact when developing digital solutions. So we understand that when there is an emergency, we need to find a solution. Regretfully, sometimes we are looking at the digital solution as the solution when we should address what we would like to address before developing the digital solution. So we can be successful in developing a tool. I would like to refer again to the contact tracing apps. We have seen several experiences, of course, I don't want to name countries, in which countries we have had successful examples in how this can be used, but also examples in which they have been usually be malpractice, I will say, and how this has been used across the European region and at the global level. So I think that having this vision, governance, and trying to fit what is going to develop as part of a digital ecosystem is critical. And maybe taking a few more days to reflect and to develop something can save more lives than it was prevented at the beginning. That will be my 2 cents on this. Thank you.
Thank you, David. I think it also gels really well with what our other speakers have been saying. For example, Aidan, everyone needs to be aligned. That takes time. It's not that easy to do from one day to the next. Stefan, I come to you with and I also realize I'm pronouncing your name the German way. I apologize. I come to you with your example of the telemedical platform that now informs the primary healthcare solution. Perhaps you can tell us a little bit more about what that looks like. And if I think back to what Aidan was just saying about the business model for reimbursing certain types of care, would that, for example, be paid under the usual payment models for physicians, or what is exactly the setup? Perhaps you can give us a bit of a flavor there.
So thank you, Dimitra. If I had to look at the primary healthcare telemedicine center there, what really worked well is that before the launch of let's say literally just before the COVID-19 pandemic started, they had just completed the deployment of an electronic medical record, electronic patient record in full. And in parallel, there was an organization-wide deployment as well of the latest Microsoft technology. In that particular, that means that there was Teams, it was getting deployed, all of these. And the mix of these two together allowed very quickly to set up the telemedicine center. So that was one of the successful ingredients. That means that there was preparation, that there was vision earlier on to bring these into fruition. So if that wasn't done, it would have been much more difficult, or it would have taken longer, or it would have taken even it would have taken months to get there. But it happened within a month or two, literally, if not faster, just because there was all the ingredients in place. And someone literally had to, start cooking. Also, what I found incredibly useful as well, that there was a good mix of top-down and bottom-up leadership approaches. That means that there was a high-level stakeholder involvement, but there was also, the people on the ground who were, focused on making this work. So the mix of both, not just one way or the other, the mix of both really made, I think, made a good, so to say, good combination.
Thank you. I mean, that is really important that you point that out. I think we are in agreement. One thing that I also take away from your message here, Stefan, is that it's easy when we think about digital health to think about individual things, like, for example, telemedicine, and say this, I want to focus on this, and I don't want to think about electronic patient records, or I don't want to think about data infrastructure. But it's actually not possible, because they are really interlinked together in a fundamental way. And I think, Mirko, that also is reflective of the Veneto experience. Over to you.
Yeah, I think that's putting a standing pressure on breaking silos between individual solutions that were built in the past years has been the most important thing, and the most important tool that COVID-19 pandemic gave us. And this is the direction that I think the whole system should use to bring back to the patient and to the healthcare professional the data they input in the systems. So standing pressure on breaking silos between individual, technical, maybe long-standing small solutions to a bigger environment, and then to force and bring back to the one who gave us the data, so the healthcare professionals, for the clinical use, and to the patients is the other key points for shifting something that is used on spot, on demand, for emergency, to maybe with a slower development, but for a standing way of using as a part, and an appropriate and accessible way for the patients.
Thank you. We come back to you in a second, and to all of you, about this question that was pointed out a couple of times of what is good to invest in, what is not good to invest in, when is it appropriate, not appropriate, and when do we decommission? Stefan, I think that was on one of your slides, but Aidan, over to you first on this, let's say, practical facilitators.
I think that there is no secret ingredient, because we would have used it if we can. I think it's a mixture, it's a cocktail of things, depending. I think that what's, first of all, it's the distance between the impact, disruption in care. Why teleconsultation grows so rapidly? Because basically at the heart of teleconsultation is a consultation. So you can reimburse for it, the same mechanism. All you have to do is to open the gates, and you put the phone or computer, and it does work. Telemonitoring is a little more complicated, because you have more complex organizations, and therefore some people in the organization win something, other lose something. And if you take some digital therapies or digital applications, then sometimes you can completely replace one actor of the care, and therefore thinking of business model requires to think of the organizational model, and what makes it, I think, the preparedness and the fact that the organizations were pre-existing before COVID, and COVID provided a use case that showed that it was useful, and therefore people really came to consider that, okay, that's a good thing, then we should go. I think that what made it really impactful. And the other thing is the willingness to take risks and experiment things, because one of the main holding back factor before COVID was that people were saying, oh, but this is maybe dangerous, maybe you shouldn't do it, etc., etc. And there were many reasons not to move, and COVID broke it up, and people said, let's try it. And I think that having the capacity to recreate a situation where you can take risks, you evaluate, and then you decommission things that don't work. Say, okay, this doesn't work, but we have tried it. But we judge things on, don't judge a book by the cover, but what actually it does make when it's running. It's very interesting, very important. So that's a mix of all that, I think, that would make it interesting. But in the framework of a strategy that is designed purposely to do that. And that's probably what we were lacked before, as the strategy of digital was like, we investing in big IT projects. We didn't now have a vision of how all this could evolve. And also another very important factor is building the human resources capacity and the knowledge of a healthcare professional, because we've talked about illiteracy for patients, which is really an important factor, but there's also illiteracy for healthcare professionals, or at least they're afraid of using sometimes those kind of tools, and therefore it so needs to be addressed.
Thank you. I think that quite crucial points, and also reflecting very well the categories that David was showing us in the very beginning. I pick on the very last thing, Aidan, and you muted yourself, maybe too fast. How do we foster the willingness to take risks? So what is, you say, willingness to take risk in a slightly controlled way, so not like extremely, let's say, openly, but what are the possibilities? I mean, in the COVID-19 pandemic, we had in some certain situations natural experiments, let's say, right? But if we are thinking about looking forward, I know, for example, you have an innovation fund mechanism in France. Is that a model that could work?
That's our assumption. We think it's interesting, but also we need to the interesting thing of innovation fund is not necessarily to test innovations, but to test the system. That is, what prevents these innovations from entering the system, what we need to change in a general regulation. And therefore, regarding digital innovation, we realized that they were regulated as medical devices, which is, of course, the legal definition, but there is nothing in common between a HIP processes and a digital application. So maybe we need to have a specific consideration about the business model, about the key actors in the sector, about how they take place in the care pathways. And I think that's all of this that should be here. So experiment, but not for the sake of experimentation. Experimenting because you want to scale it up, and therefore you need to change also the global regulation, and experimentation is interesting only in this context. If you don't do that, then it's, I think, time lost just to experiment without having this in mind.
Indeed, thank you. And I think this is also one of the areas where it's very useful to join forces across countries. And there are a couple of initiatives at European level, for example, on business cases and how to best reimburse digital health apps, and how the role evidence plays, and how to decide which evidence actually works and doesn't work. I go to Nicole for our chat, which has been quite active, as I can judge from the pop-ups on the screen. Yes. Give us a short summary so we can feedback.
So initially it was still a little bit quiet, but now people have started to post questions. So I'm just going to quickly pick up the main ones. So one was about regulatory agencies and professional bodies and how they can address the regulation of digital health tools, and specifically whether speakers could reflect a bit on what the quality measurement should focus on and what the objectives of regulation should be. There was also discussion about these common strategies, such as the ones from WHO that we've heard about, and how we can make sure that common strategies are able to work at the national and local level. So how can we actually adapt them to the needs that specific countries or contexts might have? Then we had a very interesting point about remembering that at the moment digital health tools have a complementary role, and they should not institute a substitution for healthcare delivery. So how do we ensure that IT solutions actually do not increase inequities in healthcare deliveries? Yeah, that's me.
So that is a lot, especially for the 7 minutes that we have left in our allotment today. But I think also with some common threads, Nicole, right? So role of international level, role of national level, role of different actors within the health system. And what I would suggest is that you briefly let this go through. I will start with Mirko this time, then go to Stefan, then go to Aidan, and then to you, David, to close us off for the day. So reflect a little bit on these different levels, and what the takeaway message can be about what we can do at the international level, what we can do at the national level, what we can do at the local level, perhaps. And Mirko, this is why I'm starting with you, because you showed us very clearly the interplay, at least when it comes to the Veneto region and the Italian experience. So over to you for a final reflection with your thoughts from the hour.
Thank you for all the inputs that came during the session. I think one of the most important points I would like to underline is the necessity to strengthen the capacity of public health for the procurement agencies, for the regulatory affairs. Otherwise, digital health is kept as a solution that came from nowhere, going nowhere. So that's very important for the one who designed the system to deploy the solutions, to explain to the healthcare professionals, and to engage patient associations that are on the same line, on the same page, and have the skills to understand and to design in which way the system and the actors should interplay. I think it's the most important thing. Otherwise, we are not going to shift the whole machine, our system. So the way the local and the regional and the national agencies provide good quality care in the new alternative but parallel complementary digital way. That's the most important thing, I think.
Thank you, Mirko, for pointing this out. Capacity is very important, and I think the thing that we won't have time to discuss today at all is this interplay between more digital health solutions, meaning also more room for our existing capacities to do perhaps other things. But this is quite a tricky question to discuss, by the way, now. So I think we thank you here, and we go to Stefan for his reflection before we go to Aidan and then David.
We definitely need to focus on building strategies and roadmaps across all member states, so that we need a blueprint. We need a way forward. So that's going to be very critical. So we need a strategy which is high level, but roadmaps that are practical on the ground and actionable. Things that can be actioned from today to tomorrow, from today to next month, from today to next year. Supported by financing, so we need to advocate and ensure that digital health and health data are line items within health budgets. They need to be that needs to be important more than ever. Legislation is key. I will reinforce this point that I mentioned earlier on. And I agree with my colleague Mirko that we need to, upscale our human resources to have human resources that are focused on delivering digital health and health data interventions. Over.
Thank you very much, Stefan. And I keep realizing as you speak that we probably need a webinar series on this to pick out individual topics. We talked about the workforce now, the financing models. Because I keep thinking, is it a separate line in the budget, or is it actually within the service categories and reflects also the business case model that Aidan was talking about? So Aidan, over to you, not necessarily on this, but on your final reflection for today.
Yes, there was a very interesting webinar. I'd like to say, first, I think that I'm very sensitive to the discussion, the aspect that these are tools, and we should consider them as tools for caring for patients. And therefore, the usage is very important, because a tool that is not used has no value. So it's very important to reflect on that. And to go on healthcare is international. I mean, the care processes, the medical practices are international. Therefore, if you want to implement digital in it, then you must be international. And I think the important part of the regulation, I will make a parallel with the data regulation strategy. We have a regulation, GDPR, which is very important in order to build trust around the usage of data, and most of the technologies rely on it. So I think if we make the parallel, we should probably have regulations that set frameworks so that people can evolve in trust for all actors. But there is also space and room for in specific countries or regions to have the specifics that can be made for all this. So I think that there is the need to have global frameworks so that data can be exchanged, practice can be exchanged, trust can be here, but also acknowledging the fact that care is practiced at the patient level. So teams must be, healthcare teams must be comfortable with this. And I think that building this sort of a framework and pyramid is something that could help implement all these. And considering, once again, this is very important, technology is a tool. Technology is not an end. And probably too often we see through the technology lens, not enough into the technology as part of the care.
Thank you. Very, very important that you highlight this so that we remember it. I think often people who work in this area take that as a given, or often not, as you say. So that's quite an important point to make. David, you heard all the mandates coming in for the global perspective. I think you are delivering on that already, as you have shown us in your slides. But perhaps a couple of reflections about what we can look forward to from you moving forward.
Yeah, thank you so much, Dimitri. And very quickly, so first of all, I agree with the colleagues that we need flexible long-term. That's clear. We need that to move forward. So there is a lot of work ahead of us, and I would like to say that we are all the time saying we need to, and that we is us. So when I say us, is the people connected today, Dimitri, Nicole, and the colleagues connected today. So that we is us, and diseases will continue coming. So we just need to be prepared for that and only working together, because diseases don't understand about frontiers, and the same should apply for digital solutions. So when we are all on the same page, I think that it will be easy for us to move forward. And just as I mentioned before, just to mention that first quarter, we will release a regional report on the status of digital health. And I think that for us will be a game changer about what should be addressed at the regional level. Thank you so much.
Thank you very much, David. I think all of that really promising. Also a lot of information from our speakers in the chat about upcoming initiatives. So take a look. We won't have time to address all of them, but we're so grateful to all of you for being here. We as the observatory are particularly grateful to EPHA also for joining forces. And thank you, Philip, for the wonderful co-moderation today. We wish you all a nice rest of the day, a nice holiday season. And we'll see you next year, definitely also on this topic in one way or another. Thank you very much. Enjoy the rest of your day.